The purpose of this video is to demonstrate what we consider to be an ideal conservative onlay preparation for gold onlays. We strongly suggest that gold is the ideal restorative material for onlays because when properly done, they can serve the patient for a lifetime. We will use two different preparations to illustrate all of the steps using a head-mounted video camera at 3.5x magnification. The philosophical guidelines for this procedure are threefold. First of all, one must have occlusal coverage to prevent functional wedging. The tooth in this demonstration had a mesiovertical crack, thus requiring the onlay to prevent further propagation of that crack. Secondly, we want the least amount of preparation that we can achieve for that particular tooth and still accomplish the goal. Think in terms of dental tubule amputations. The fewer we cut, the happier the pulp will be. Thirdly, because we are using gold, the preparation can have the maximum resistance and retention form. These dies represent proper preparation form. There is minimum angle of draw and minimum reduction of tooth structure. This silver-plated die demonstrates the same thing from the interproximal perspective. The old occlusal amalgam had some soft dentin underneath it, so every trace of that is being removed with a round burr and then with hand instrumentation. This is a very small, very sharp spoon excavator. Proper technique for sharpening a spoon excavator is very important. Do not allow the stone to drag out beyond the end of the spoon. If it does, it will round the end and thus spoil the sharpening. It is the very end that is the critical sharp component of the spoon. Every effort is made to get the dentin perfectly clean. The internal occlusal reduction is done using the diamond as the measuring tool. This is a Brasseler 8876 diamond. This is minimal reduction, so when you're all through and take the rubber dam off, be very sure to have the patient close and tap their teeth together a few times and then check to see if there is still sufficient reduction. It is possible that the second molar required an increased condyle to eminence dimension, and when it is reduced, the condyle may rise toward the eminence. Understanding this occlusal change is thoroughly explained in another video on our study club site concerning the TMJ. It is important that the diamond remains parallel to the angle of the supplemental grooves and triangular ridges. The next step is the external occlusal reduction for both the lingual and buccal cusps. The next step is to create the buckle wall. Note the angle of the diamond. It is essential that this be nearly parallel with the other walls which are yet to be cut, but it needs to be steep because it's one of the reciprocal retention and resistance form walls. The depth of the cut is the diameter of the diamond. Again, it is your measuring tool. The same is true for the lingual wall. It needs to just barely draw versus the buckle wall. A large, flat-end, slightly tapered diamond is used to finish the pulpal floor and the buckle and lingual walls, again making them very resistance form oriented to the external walls. So again, these are part of the resistance form feature. The extra fine flat end Brasseler number 8846012 is used to finish the milling of the buckle and lingual walls and the interproximal box or boxes. The point here is by squaring off the base of this wall, you practically double the length of the retentive resistance wall. A groove at the mid-buckle point, as shown here, greatly enhances the resistance form. It doesn't have to be very deep. Note that the entrance walls are slightly rounded. The proximal box is milled, again maintaining near parallelity of the buccal and lingual and axial walls. This sharp edge is slightly rounded. The mesial crack on the gingival floor is readily seen here. Finishing the lingual shoulder. The bevel is milled using the Brasseler 8884 diamond that has a 60-degree taper on the end. "60 degrees is thought to be about the right amount of angle for the bevel. It is steep enough that the mathematics of marginal closure when seating is excellent, and it is shallow enough that the strength of the gold at the margin is still adequate. It's a compromise between those two things. It is important to very slightly round the sharp junctions between the various planes internally, because those are vulnerable on a stone die to breakage. And if you lose some stone on the die, then the casting won't seat when you're done. Again, the sharp edge is rounded. The finished gingival bevel. This junction between the two walls needs to be slightly rounded on all four places to avoid, again, the risk of losing some stone on the die. Again, the rounded junction where the wall from the box meets the buccal and lingual walls, that just to take the sharp edge off. The internal walls, which add a huge amount of resistance form as they reciprocate against the external buccal and lingual walls. And minimal depth grooves, which again add more resistance form. The contact area on the previous casting was a little bit too sharp and a little bit too high. So the goal here is to give it a more normal, ideal form. One of the many advantages of an onlay versus a full crown is that it's relatively easy to get a perfect impression. We hope you will find this to be helpful in taking good care of your patients.